Hello. We're currently in our hygiene series. Today we're likely going to be ruffling some feathers with some of our concepts here on a good hygienist versus a remarkable hygienist. It's okay if you get a little ruffled. We care about you far too much to hold back. This lecture is simple. It's going to go through many of the actions that we have found to be the critical differences between those who just mail it in and those that truly excel. If some of the good hygienist things are practices that you have been taking, don't worry. Remember, we're here solely for the purpose of making you better. Your job is to simply watch and reflect. Find the areas where you believe you can improve and implement these things. You may not see immediate benefits of these things because not all wins are met with praise, but you can take pride in knowing that you're doing an amazing job. A good hygienist will say hello to a patient and bring the patient back to the operatory. A remarkable hygienist will say it with a smile, ensure that body language is welcoming, specifically say welcome or welcome back to a patient. Ask the patient questions, make sure that they radiate friendliness. A remarkable hygienist does not fake it because they have it ingrained into their belief system that this is their duty. Assuming policies and protocols are well made in the practice and in the best interest of the patient, a good hygienist will follow policies and protocols when it's convenient. A remarkable hygienist will do so with each and every interaction. The remarkable hygienist has put actual thought into the policies and protocols, questioned them and discussed them with ownership if necessary, and understands why they have been created and how they can benefit patients. A remarkable hygienist knows that the most valuable service they can perform to the patient and to the practice involves all things surrounding the hygiene check with the doctor. The gathering of information, the discussion with the patient, and an amazing hygienist to doctor handoff, when done correctly, truly separates the good from the remarkable. A remarkable hygienist understands that a patient's restorative needs and nuances exceed the periodontal needs and nuances in terms of breadth by a wide margin. Occlusion, muscles, nerves, teeth, restorations, etc. The remarkable hygienists understand that if they spend much more time with the patient than the doctor does, in most circumstances they have a better rapport with the patient. They have the patient's trust more than the doctor in many situations. And as such, understands that the patient's restorative care is one of the hygienist's top priorities. I understand that this is a paradigm shift for most hygienists, but it is totally true nonetheless. A good hygienist thinks that I'm ugly. A remarkable hygienist knows that I'm ugly, but is able to look past this dreadful visage and is able to see that I want them to be awesome so badly. A good hygienist reminds a patient that they have planned but unscheduled restorative treatment. A remarkable hygienist will ask them questions about their values, motivation, and specifically why this care is unscheduled. They then will provide advice and guidance to that patient based on that patient's specific answers. The hygienist will then articulate those answers to the doctor. Therefore, the remarkable hygienist plays a large role in getting patients scheduled for the care they deserve. A remarkable hygienist will continuously look for problems with a patient's dentition, discuss these problems with the patient, and then articulate these findings with the doctor, along with what was discussed with the patient. A remarkable hygienist consistently educates the patient, not just on their periodontal health, but on all things oral health. The patient advocate piece is important to the remarkable hygienist. Every hygienist has questions about and questions doctors' decisions. A remarkable hygienist will take the initiative to find out the answers and engage that doctor in educational discussions. A remarkable hygienist has engraved the words over and above for the love of my patients on his or her heart and soul. A remarkable hygienist understands that they are not in a bubble, but rather part of the entire team. Restorative and hygiene are absolutely not made to exist separately. Turning rooms, helping with radiographs, helping with photos, periodically assisting when needed, and all other teamwork things of that nature create an incredible working relationship with the doctors, the assistants, the front office, everyone. Respect in this manner is earned and the benefits are awesome. A remarkable hygienist understands the power of knowledge. he or she understands the reason that things went wrong and understand that it is not possible to properly remedy health concerns or prevent them in other patients without this knowledge. I hope you spend time reflecting on these things. Often these concepts are tough to digest because they come with crazy amounts of work and effort, but the fruits of this labor are so amazing. Thank you everyone for watching. We hope to see you again soon.